Alright, well this is kind of an interesting case. This is a 77-year-old individual, and what he wants to do is fix his front teeth. And we did it in stages. We actually want to do the lower teeth first and then do the upper teeth second. He also has a Class 2 Division 2 bite. So it means his laterals are kicked out a little bit and his front two teeth, they are tucked in, so when he closes down, he just kind of has that overclosed bite. So we're able to work this through by using porcelain. Of course, ideally going in with orthodontics would make sense, but he's 77 years old, and I think we're just going to do it with restorative treatment first, or just do that instead of orthodontic treatment. So let's go ahead and get into this case, and hope you like it. Okay, so as we can see right here, he has just kind of a decent arrangement of teeth. Nothing's too far out of line, but if we take a look from the side, that's when you can see the laterals sticking forward and the centrals tucked back. And here you can see his regular occlusion, at least coming up from the bottom side, getting that view. And here's just a closer up view of the lower front four teeth, which is where we began first. Prep the teeth for just traditional veneers. We'd like to go ahead and break through the interproximal contacts. Then we take a shade tab so that the lab knows about what color they're going to be trying to work off of, so I can get the right shade. And here we can see that the final veneers are in place. They still needed to be polished on the incisal edges, but they are in place. Then he comes back a couple months later deciding to do the top, and here you can see the bottom teeth, they are in place, and the top ones currently look like that. Go ahead and open up the bite. You can see again what that looks like from that perspective. And then whenever we take photos for the lab before we start prepping, we like to get up close photos, and this is going to require a large DSL camera with a 100 to 105 millimeter macro lens to pick up this kind of surface detail. Again, we take shade tab photos so the lab knows what color that we're going for. He wanted the top teeth to be a little bit brighter than his lowers. Looking from the occlusal view, again, you can see the Class 2 Division 2 type of arrangement you'd see on an upper arch. The laterals are tipped out a little bit and the centrals are tipped in. So, in order to decide where we're going to go with this, decided to add some composite to the facials of both 8 and 9, kind of bringing them back out towards the front. When you look from the occlusal view, you can kind of see the arch form is starting to improve. And then prepped the facial surfaces of the laterals to kind of bring them in. And so now when you have the addition of composite to the centrals, the reduction of enamel on the laterals, you kind of get a better arch form, as you can see here. Then from this point, I'm going to proceed as if this was a fresh case as far as when I do my depth cuts. So here I just go in with a diamond burr and I just put vertical stripes of about a millimeter or so of depth, so that when I start doing my prep, I know that I'm taking off the right amount of space. When trying to just eyeball this and do it without these depth cuts, I've learned over the years that it's not as predictable. By putting in these guides, these vertical cuts, you're able to get the final result to be much more accurate of what you want and what the lab is going to have to work with. Here we can see that the teeth have been prepped. A little bit more enamel was reduced on the laterals compared to the centrals, just because of their position. And here you can see from the occlusal view what that looks like. And it looks like those teeth are kind of prepped in a good symmetrical arch form. Again, we do take shade tabs of the prep so that the lab can work from there. Here we've got the temporaries put in place, and the temporaries again kind of mimic what the mock-up that we did chairside, and that is just to get the teeth in better alignment. He comes back after a few weeks and his temporaries actually look pretty good. And we actually bond these in place. We don't just cement them. We do a shrink wrap technique, which I think that's on one of my other videos on this website, or on this YouTube channel. But this is what he looks like when he shows up, and looks pretty clean and neat. We also give patients some hydrogen peroxide brushes to kind of clean up around the gum line. So when they do show up, it's a nice pink set of gums to work with. It's no bleeding or very minimal bleeding when trying to put in these veneers. These temporaries, however, since they are on so tight, we can't just pop them off with an Explorer or with a scaler. We actually have to make cuts through them and pop them off. When making cuts, I like to use a 557 burr dry. I don't like to have any water going because I need to see where the bisacrylic ends and where the enamel or dentin starts. And when using a diamond burr, it's much more difficult to see that demarcation. So go through and make those cuts. And I wish this photo, we would have dried it a little bit more. It would have been easier to see the difference between the temporary material and the actual underlying tooth. Go ahead and make vertical cuts throughout, and then I use just your typical crown remover. Just apply some forces just by twisting it. That will pop the temporary material off, and you get most of it off, but there's still some that remains. At this point, I will then bring out a diamond burr to clean off the rest, and I also go through and make sure every surface area that this veneer is going to be touching has been touched with this diamond burr, because bonding to freshly cut dentin and enamel has been proven to be a much stronger and more predictable bond than if it was just cleaned off without being cut. And again, this looks just like our prep from before, and there's the occlusal view. And now we're ready to start putting in the veneers. We put them in, try them in, they look great, and then we cement them in place, and actually bond them in place. When going through, I'll do a tack wave technique in getting them initially set, at least the cement set, and then I use this instrument, this carver, to go around and clean up around the gum line and to remove some of it interproximally. And then I'll go in with a metal serrated strip to open up the contacts. And then once that has been opened, then I go ahead and floss it through, then go ahead and do a final cure on all of it. Clean up all the excess cement, and here you can see they look really good. There's the arch form again. It looks better than where we started. Here is both the uppers and the lowers in together, and yes, the uppers are a little bit lighter than the lowers, but that's what he wanted. And then we can see now, if we compare the before picture to the after, I think things look better. And I think that the arch form, when you compare the before to the after, it looks better as well. And so this was nice to be able to get a nice conservative case, 4 teeth on the top, 4 teeth on the bottom. Yes, it would have been nice to get the canines and the premolars as well to make it perfect, but for him, this made the most sense, and I think we ended up getting a nice result. Hopefully this was helpful, and I look forward to your comments below. All right, thanks.